Good day, everyone. This is Nationwide News.
Good morning, Philippines. Today is sunny day, November 2021.
This is Javel Batarilan.
And this is Pauline Jasmine Reyes, serving you the hottest and the most leading news of the hour. Your news, our business.
For the headlines, in COVID-19 news, local and worldwide latest updates. We will find out later. Ages 5 years old below are still not allowed to go out.
Alert level 1 to 5, 5 to 60 years old are allowed to go out.
Safety protocols are required to be followed.
Severe symptoms, what are they?
For the local and worldwide updates in COVID-19, Jamila Padilla is here to conduct details. Jamila, what are the trends today?
For COVID trends today, during 2019, last year, 100 cases reached those affected by COVID-19 virus worldwide. Now, even more, latest update on November 1 is at 416,000 new cases of those affected by the COVID virus. And in total, it is all at 800,000 more. The Delta variant of SARS-CoV-2 has now been detected in more than 100 countries and in the coming months. It is expected to become the dominant strain globally, spreading quickly in countries with both low and high vaccination coverage, according to the head of the World Health Organization. The Delta variant was first detected in India in October 2020. By June 1, it had spread to 62 countries. 2 weeks later, it had been found in 80 countries: Kazakhstan, Laos, Latvia, Lebanon, Namibia, Oman, and Sierra Leone are the latest countries to confirm the presence of the Delta variant. So, what is the efficacy rate of each available vaccine? At this point, only vaccine efficacy data is available since effectiveness depends on many different factors and requires a longer observation period. During the period of October to November 3 in the Philippines, there were more than 2 million cases of the virus. We can actually see here that there are too many infected with this virus in our country. And in the month of October to November this year alone, it has reached 43,000 more deaths. It is just sad to know that so many of our countrymen have died. While here in worldwide, there were more than 248 million cases and 5 million deaths during the month of October to November 2020. Gladly for the number of those recovered reaching over 2 million in the Philippines. And worldwide, it reaches over 224 million. Here's the information regarding vaccines. The types of vaccine available today are Pfizer, Moderna, Johnson & Johnson. People 18 years and older can get the Moderna and Johnson & Johnson vaccine. Children ages 12 and older can also be vaccinated. Pfizer is available for their ages. Just a reminder, you may experience side effects after your vaccine. You may feel fever, fatigue, headache, muscle pain, chills, diarrhea, and pain at the injection site. Another reminder is that people who are sick or have serious illnesses cannot be vaccinated because it can be harmful to their health. For medicine, there's still no medicine that can cure COVID as of now, but medical treatment scientists around the world are working to find and develop treatments for COVID-19. And this is Jamila V. Padilla reporting.
Ages 5 years old and below are still not allowed to go out. There is a math problem to guide us with this. Ariana Nunez is here to solve it. Ariana?
Good morning, this is Ariana Nunez reporting for solving the ages who are still not allowed to go outside. Find the roots of the matching equality x2 negative 80 times positive 924 less than 0 to get x2 negative 80 times positive 924 equals 0. To find out what age is allowed to go out if feasible, factor it, then draw an interval graph 1, 14 and x2, 66 on the number line. It should be divided into 3 groups based on its point. Choose any number that's simple to solve for those 3 groups. I used numbers 0, 20, and 67 to test each group on each interval against the inequality, and the number that satisfied the given inequality is 14. Finally, I shaded the interval that includes a number that satisfied the given inequality, so all x such that x is greater than 14. That's it. We solved it. Therefore, as you can see here, ages 5 and below are still not allowed to go out.
By this time, what are the ages the government allowed to go out?
Yes, Jovel, so the ages that allowed by the government to go out is 14 than 66. It is 14 because when you plot the point on the number line and you test any number of each ABC group, and the group A is false because the result of it is 924 is less than 0, and the group C is also false because the result of it is 53, it is less than 0, and the result of group B is negative 276, less than 0. 0 is negative made it less than to 0 because 0 is higher to any number that it's negative. If you want to go outside but it's not proper for your age, wait as long as possible because you might come into touch with someone who has COVID-19 and there's a big chance that you will get infected. This is Orlando Nunez reporting.
Safety protocols are required to be followed. For this report, John Roland Hustle is here to conduct information and guidelines. Roland?
Good afternoon, everyone. There are safety protocols that we must observe inside and especially outside of our houses in this time of pandemic. First, we should always wear a face mask and a face shield when we go outside the house. Also, social distancing is 2 meters apart for less chance of acquiring a virus. We should also avoid touching our mouth, eyes, and nose if our hands are not sanitized properly. Avoid crowded places because it has a higher chance of transmitting the disease to another. Lastly, we should avoid touching frequently touched objects by other people like handrails, elevator buttons, and banister because they can definitely cause a virus transmission. Now that we listen to the safety protocols, everyone must take careful action and stay safe.
Now, what are the symptoms of COVID-19 and what should be done if one of your family members shows such symptoms? Could you tell us some information, Roland?
These are the symptoms of COVID-19 patients. Symptoms may appear 2 to 14 days after exposure to the virus. Anyone can have mild to severe symptoms. People with these symptoms may have COVID-19. Fever or chills, cough, shortness of breathing, of difficulty in breathing, fatigue, body or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. This list does not include all possible symptoms. CDC will continue to update this list as we learn more about COVID-19. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be higher risk of developing more serious complications from COVID-19 illness. And what do we do when one of our family members experience these symptoms? The whole household will undergo quarantine for 14 days, and the person with a COVID-19 needs to be isolated from the rest of the household for minimum of 10 days from the start of their symptoms. Before they leave isolation, they need to show no symptoms of the virus for at least 3 days. Always remember, we care and love each other, so wear face masks. This is Roland Hosal reporting.
Thank you so much, Roland. And these are the breaking news from Nationwide News. Again, this is Jobel Batarilan.
And this is Pauline Jasmine Reyes. Your news, our business.